Hello, everyone, and welcome to Behind the OR, the Peter Surgical Podcast channel, where we invite experts to reveal to us what's happening behind the closed doors of the operating room. Together, we will explore surgeries and procedures and discover more about a surgeon's life in their daily mission. Take off your gloves, take a breath, and let's talk behind the OR.
Hello everyone, I'm Dr. Hassan DEBBAGH, thoracic and cardiovascular surgeon specialized in adult cardiac surgery. When I was first invited to contribute to this podcast series a few weeks ago, the first thing that came to mind was the question of legitimacy, what some of you can call the imposter syndrome. Usually, as you know, those invited to speak are sought-after experts or superstars of surgery, either because of their technical contributions or their scientific influence. As I was not fit in either of these categories, the second question that arose, what interesting topic could I offer? Indeed, the name of the platform, which is called Behind the OR, allows certain freedom, which is quite refreshing in the world of content creation. So that's why I chose, rather than delving into science, to focus on sharing my experience. And like the saying, what happens in Vegas stays in Vegas, these podcasts really aim to share everything happening in the operating room, but also before and after the surgical procedure or repair. Other speakers will discuss surgical techniques, the benefits of one approach over another, morbidity, mortality, short, medium, and long-term outcomes. I certainly do so. But however, certain aspects of our specialty particularly fascinates me. So logistic processes, human interactions, technical and material challenges, anticipations, and sometimes, unfortunately, the management of complications. So many themes more rooted into experience than in fundamental or experimental science. So before diving into all these points, I think it's appropriate to introduce myself. This will give you a little idea of my background, but also explain why certain topics are particularly close to my heart. To put it into perspective, there's a real leak of brains and competencies here in Morocco. So unlike the 700 doctors who leave the country each year hoping for maybe better opportunities elsewhere, after 20 years of expatriation in France, I rather chose to return and settle in Morocco. So what may seem like a natural process to some was not really an easy move to make after so many years abroad. This expatriation was not only academic and professional by completing med school, then residency and post-residency there, but it was also a social and cultural exile. So one would think, what were the reasons that made me reconsider my career choices? Some were personal, others imposed or constrained, if I may say, by the law of the market. As long as I can recall, the last well-documented report on the distribution of cardiac surgery activity in France dates back to maybe 2015. So out of 63 accredited centers, 36 were in university hospital centers, I think 22 in private for-profit centers, and the last 5 in non-profit structures. On the other hand, training in thoracic and cardiovascular surgery, and more specifically in cardiac surgery, is organized almost exclusively in university hospital centers. So after a 5 to 6 year residency, depending on the future surgeon's academic profile, a minimum of 4 years of post-residency is desired before gaining full autonomy. This responsibility transfer curve remains relatively slow and highly dependent on centers. This can easily be explained by the vital rather than functional nature of cardiac surgery when compared, for example, to orthopedics. Assistant surgeon positions are necessary step in training, but remain very rare and precarious, pushing many of young surgeons towards a form of nomadism every 2 years. Many of them, myself included, find themselves forced to accept temporary contracts without the assurance of promise of a permanent hospital position by the end. However, these positions are crucial after several years of experience for joining private surgical associations, as one must indeed have honed their skills in public hospitals with a well-established network of contacts and correspondence to hope to become associate. Many young surgeons, lacking better options, are forced to emigrate or expatriate, most commonly to French-speaking countries like Canada or Switzerland. As I'm not fond of long winter evenings or polar climates, my choice naturally leaned towards my country of origin. Armed with the knowledge acquired from my many mentors who will recognize themselves and whom I salute, I decided to return to Morocco, where my skills would be first more useful in terms of medical demographics and healthcare service, and secondly, to be honest, the desire to be close to my family again was certainly not the least of the reasons. Once the decision was made, it was time to take the plunge. So, this did not come without certain logistical difficulties, as moving professionally is never a simple matter. It must be organized, and I learned this somewhat to my detriment well in advance. The right to practice in a country, even when one is a native, is never guaranteed, especially with foreign diplomas. First, I had to obtain the equivalence of these diplomas, the medical doctorate, then the specialty diploma, to hope to be registered to the specialties board as a cardiovascular surgeon. Morocco unilaterally recognizes the equivalence of French diplomas under certain conditions. It was a real stroke of luck as I fit within the framework of this very recent law adopted a couple of years before. Not everyone has this luck. For the record, my brother, also a doctor who studied abroad, had to go through the old equivalence process, which cost him almost 2 years of presence in public hospitals without a real assessment of his skills, which was a real waste of time and energy. So once the equivalence of the diplomas was obtained from the regional, then the national medical councils, the steps to contract with health insurance could begin. If there is one piece of advice I can give, it is to undertake these steps several months before settling in. Indeed, it is as logically as elsewhere impossible to practice until these authorizations have been granted. But bureaucracy being bureaucracy, it took my file at least 6 months of back and forth between the various administrations to get the right to operate on my own patients. You know what they say, you know what you are living, but you never really know what you're getting into. So before returning to Morocco, I had to explore to get an idea of the opportunities present and maybe to create. So between medical overpopulation in some cities and a lower quality of life in some medical deserts, I had to find, let's say, a balance. A proposal from a colleague who had made the same move few years before me came at just the right time. Forming a team was really close to my heart. During the months of bureaucracy waiting, I was unable to recruit patients under my name, so I mainly helped him operate on his patients without seeing any real prospects emerge. The agreement protocol we wanted to set up was akin to an association of surgeons model. But this was logically requiring recruiting patients on my own. So our divergence in the very concept of a team became so obvious when I indeed started to communicate with cardiologists for this purpose. The private sector health professionals in Morocco, especially in specialties I would qualify as high ego potential, do not have that team culture at all. So with a real patient and an awful conflictual relationship to money, there is still much to think about on this. This professional incompatibility forced me to look elsewhere and start from scratch. This false start could have made me doubt staying in Morocco, but on the contrary, it was a real driving force. I had only one desire: to set up a cardiac surgery center based on what I consider to be an ideal model, the heart team, still in Tangier. Another challenge when arriving in a new environment is making oneself known in an unknown territory. People did not wait for you, and you are certainly not the messiah they hoped for. So even equipped with the best degrees and diplomas and mastering the latest techniques that can definitely become a real added value to the local healthcare offer. One must, above all, remain humble. Colleagues, I particularly think of cardiologists, surely already have their correspondents with whom trust bonds have been established for and over a long period of time. Patients also trust their cardiologists. They will not come to see you for surgery on their own. It will then be necessary to develop another skill aside of humility, a technical one, communication. And let's acknowledge something. We are definitely not good at this. So how to do so? As cardiac surgeons, we are more comfortable in planning things. So you have, first of all, to identify your interlocutors, your communication channels, and the nature of the information you want to deliver. The interlocutors are numerous. The doctors first. The ideal process, if you ask me, is to go through the regional medical council and get the list of colleagues practicing near your place of work. The most appropriate is to contact them one by one and make appointments with them at their place of practice. This tour is highly appreciated and will be an opportunity to put a face to your name. Briefly, present your background and skills. Believe it or not, I was often asked if I performed valvular as well as coronary surgery. This exchange is usually short, no more than 5 minutes, and courteous. Do not hesitate to leave your business card, by the way. Few surgeons take this step. You will definitely stand out for this availability. Your second interlocutors will be the patients. At the stage where you have not yet recruited, it is difficult to reach a large audience. All the challenge is making yourself known without falling into the pitfalls of advertising or clientelism. If you have this knack, you can use social media. The form and content of what you will offer will naturally differ depending on whether you use platforms with a professional connotation or those more mainstream. On platforms like LinkedIn, it's preferable to communicate about your installation, the availability of your teams, the surgeries you offer or you practice, with possibly occasional image feedback of interventions in the operating room. It's up to you to judge what seems relevant to publish. Images of a first, presentation of the effectiveness of a technique, clinical studies, medical or university partnerships, and even industrial partnerships. On mainstream platforms, your publications will need to be more, let's say, didactic, explaining the different pathologies and their treatments. Short capsule formats are the most appreciated and consumed. The words must be simple and the analogies close to everyday language. You will obviously have to juggle between scientific vocabulary and common language, preferably in the most widespread dialect in the media, if it differs from the official language. As here in Morocco, we have classical Arabic, but we have a dialect which is called Darija, which is, let's say, a mix between Arabic, French sometimes, Berber, and which can also differ from a region to a region. So be very careful to the language and the words you use to be closer to your audience. Do not hesitate at all to write and work on your scripts in advance, or surround yourself with professionals, content creators, communication agencies who really master these processes. It's a real job. This was just a glimpse into the start of my journey here. Many challenges are yet to come. It will be my pleasure to share with you the overwhelming excitement, but also sometimes the deceptions through the process. In the next episodes, we will delve deeper into what it takes to found a cardiovascular facility and the insights of building a heart team. So hope to catch up soon. Thank you for listening to Behind the OR.
Let's meet at EX 2024 in Lisbon on the booth 230 to discover more about surgery, education, and innovation.